And we're here this half hour to talk about your mouth. And, you know, your mouth is really the portal to the outside world for the rest of your body. There are over 6 billion bacteria of more than 700 different species living in your pie hole. And that can really affect your health from head to toe. There's a bacterial connection to the cavities that you get. Why are some people just prone to having cavities, and is there anything you can do about that? We're going to talk about a lot of this with our resident expert on oral health, Dr. Dave Deal from DuPont Family Dentistry. Good to see you in here again.
Good to see you too, Lee.
So your gums are critical to your health. They're like a gasket.
Mm-hmm.
I'm a car guy. You're a car guy, right?
Absolutely.
It's like a gasket. It's the sealer that keeps the outside world out. And when it doesn't work right, that can really put your health in jeopardy.
Absolutely. And I think that's a great analogy. I've actually never even thought about that. That's a really good analogy. You know, the bacteria in our mouths, need to stay in our mouths. But when we have an unhealthy gums, unhealthy mouth situation, bleeding is a very common thing that you see. And once those bacteria get into your bloodstream, your mouth is very close to your heart, very close, it's going to get into your circulatory system. And those bacteria are going to cause problems in your body elsewhere.
Yeah.
They're not supposed to be there.
And all of us have, as I just said, billions of bacteria in our mouth, and the mixture of those bacteria can be controlled by a number of things, the foods we eat,
absolutely,
medications we take. What are some other factors?
So, the biggest thing anymore to me, the most immediate impact that I see is medications. I have somebody come in and everything's healthy, everything's really good. Certain medications will cause dry mouth. A lot of medications will cause dry mouth. They get on these meds, saliva dries up, and the cavity rates go through the roof. And I've seen major damage done to teeth in a very short period of time in people that would, traditionally healthy. Aside from that, the American diet's just getting worse and worse. My office is across the street from a Starbucks, and it really is amazing to me how many people are standing in line all day long, for breakfast, maybe a snack, and then dinner again. And the amount of sugar that we ingest each day is becoming an issue, a real issue. So, and especially when you do it repeatedly, so you're having a snack throughout the day multiple times, the acid levels in our saliva just keeps going down, and we don't give it a chance to neutralize or get to an alkaline state.
So let's talk more about exactly what that bacteria can do in your body by bringing to the program Michelle Hudson. She's a dental hygienist who's really on a mission to educate the world about what happens when oral bacteria attack. Michelle, good morning.
Good morning. How are y'all?
We're great. So glad that you're here with us. Tell me about how bacteria in my mouth can increase my risk of heart disease and some of the other conditions that might be affected.
So heart disease is really, I can talk all of those pieces. Heart disease is really my field of expertise, that oral systemic connections piece. So you have these specific bacteria in the mouth that if you have, active periodontal disease, so gum disease, so if your gums are bleeding, and a lot of times, Dave can educate you on that, a lot of people don't realize that their mouth is bleeding and until they come in and see us, and then they blame us, right? But if you have disease within the oral microbiome, so in the mouth, that travels, like both of you have stated already, that travels throughout the body. So let's just look at the arterial wall. And so the arteries in our body, within that wall, they have found these high-risk bacteria. There are specific ones, and there's really 4 or 5 that we're very concerned about, and that actually Dr. Brad Bell and Dr. Amy Doneen and Dr. Vigorous have done some research on. There's a peer-reviewed study, so this isn't us guessing or thinking maybe. There's a peer-reviewed study on this. And they are bold enough to say, the first physicians bold enough to state that these oral pathogens actually are causal in heart attack and stroke, and as much as 50% of heart attack and stroke are due to these specific bacteria. There is also studies that have been reported in by the American Heart Association they're saying, of course, that it's an association, but I'm okay with that because they're getting the information out. It's important to know that, for years we thought, I'm just going to get my teeth cleaned. It's just a cleaning. It's so much more than that. I mean, we have to continually disrupt that bacterial load because we know that when when those bad bacteria get out of control and they kind of take over, that's in your body, and it not only we now know is associated with heart attack and stroke, it's associated with cancers. There's one bacteria, and it's a spirochete bacteria, so everybody knows Lyme disease, right? Mm-hmm. So you have it's not the same Lyme disease bacteria, but it's Treponema dendicola, and you can actually see that on a microscope. So we use microscopes in our office. We know that 97.3% in one study that was done of patients that had passed with Alzheimer's and dementia had that specific bacteria within their brain.
Yeah, it's frightening, isn't it? That bacteria in your mouth can contribute to Alzheimer's, dementia, all that kind of thing. When I look in my mouth, Dr. Dave, when I look in my mouth, what are signs that I have that gum disease? How am I going to know?
Bleeding is going to be the quickest and easiest one. If you look in there and the gum tissue is bright red, doesn't look healthy and pink, those are going to be the simple things for people to look at. And the one thing I always kind of a little bit laugh at as dentists, we're very cautious. If people have bleeding gums and they've had an artificial hip or something, we got to pre-medicate them, and while you're getting their teeth clean. But the reality is that people are walking around at risk all day long. If you are, you bump a straw into your gums or you brush your teeth and you're bleeding, every time you do something, it's not just when you come to the dentist, anytime you actually cause bleeding in your mouth, you're introducing these bacteria in your bloodstream.
So if brushing my teeth causes my gums to bleed, I'm likely to brush my teeth less.
Yes, exactly.
And then they're in a vicious cycle. What do you do about this?
Well, that's a common belief, is that a lot of people say, hey, that area's been bleeding. I kind of avoid it, and it just gets worse and worse and worse. Stop. You got to brush it. You got to get in there. You got to come in and see us. Get those things taken care of. Bleeding gums are not normal. It is not healthy. You should not have any bleeding.
Go ahead, Michelle.
I don't floss my teeth because it causes my gums to bleed. And it's like, it's because there's infection there. It's inflamed. And that's 35% of your mouth. So it's like taking a shower and only, washing half your body. Like never washing your hair. Think about that.
Yeah. So what can I do once it's there to get rid of this infection, this gum bleed?
First things first, start with your dentist. Go in, get a good evaluation, get a good cleaning, understand where you're at. Most people are going to fall in a category where we get you on a regular regimen, we're going to take care of you, you're going to be all right. Over-the-counter, toothpaste and mouth rinses are not bad, of course, they're fine, but you can take it a step up from there. There's definitely prescription strength, mouth rinses and toothpaste that we recommend all the time that are much, much better. But utilizing those things, I'm a huge advocate for a Sonicare toothbrush. Floss. If you're like me, pick up a dental little interdental brush and use those. And anything you can do to get in there, like Michelle said, you interrupt that flora, that bacteria that's in there. You're going to definitely reduce the. It's hard to explain this part of it. Bacteria is in there, but bacteria is good, but it can turn to be bad. So what you're trying to do is create a healthier environment in your mouth so those bacteria don't act badly.
Yeah, there's good bacteria, bad bacteria, and it's a balance you have to keep.
And there's good bacteria that turn bad.
Hey, Michelle, we're going to let you go. We need to run, but thank you so much for joining us and helping us understand more about the whole systemic issue that can be caused by what's happening in your mouth.
Thanks for having me.
Thank
Y'all
you, Michelle.
enjoy.
You bet. Happy weekend. So now, is it possible that there are people who are just prone to cavities? It seems like you go to the dentist and every time you've got a cavity. What can you do about that? We're going to touch on that and much more as we talk with Dr. Dave Deal from DuPont Family Dentistry right here on Health Call Live on WOWO. And we are back to Dr. Dave Deal from DuPont Family Dentistry having really an interesting conversation here in the studio during the commercial break about toothpastes and the variety therein. You said that some toothpastes just work better for some people than others. It's a personal thing.
I agree completely. Yeah, over the years, I've just kind of found that I'm a fan of certain over-the-counter toothpaste and not so much of others. But for some people, it seems to work well for them, and so you just have to play around with it a little bit. We were talking, different reasons why you choose different ones, but you find a good one over the counter, great, use it. But if you are really interested in preventing cavities and really kind of stepping it up, invest in the prescription strength ones. Go to your dentist, go to our office. Carie-free products, I swear by, been using them for 12 years, definitely a step in the right direction.
Carie-free, the name comes from dental caries, that's in reference to decay. That's a cavity, right?
Exactly.
And are some people just doomed to a life of filling and drilling? I mean,
gosh, it's sad. The reason I got into using these products was because of a handful of patients at the time, but one specific patient, every time I saw her, she had 4 or 5 cavities. And I know she's brushing. I know she's flossing. She's doing everything she can. I can see it. And it's disheartening. She's losing faith in dentistry. She's losing faith in what she's doing. And, when we put a filling in there and 2 years later, she has a cavity underneath it. And I'm like, well, gosh, I can fix these things all day long, but how can I prevent the cavities from happening? Of course, traditionally, you're going to recommend fluoride and floss and all that. She's doing all that stuff. So in those kind of people, that's what drove me to finding a product like Carie-free. And I felt very lucky to find it early on. We've been using it for about 12 years. And I'll say this one girl, has been on Carie-free. They can get different products in their product line. She's been on Carie-free products for 12 years, and she's not had one cavity in 12 years.
Wow.
And prior to that, she was having 4 or 5 every time I saw her.
And what is it doing that makes that difference? Is it changing that oral biome?
Yeah, so it does several things. It's going to neutralize the acids in your mouth. It's going to promote the health of the good, healthy bacteria. It's going to kill off the bad bacteria. Has xylitol in there that helps with that. And there's a couple other things there, but it just creates an environment that really does make a difference.
And I saw that there is a carie-free gum.
Mm-hmm. Yeah.
What is it? So chewing gum is good for me?
Well, yeah, of course, yes, it is. If you get a good gum, you're going to be chewing. That's going to stimulate your saliva. It's going to neutralize the acids in your mouth. It's going to help out in every way. Carie-free products are kind of fun. If you go on their website and you start looking around, there's certain ones you can buy over the counter through Amazon or through their website. Then there's certain prescription strength ones you got to get through a dentist, but they've got suckers, they have mouth sprays, they have all kinds of things that you can use. All of them are designed to help out.
Oh, we have a caller. We need to jump out to the phones. Let's see what your question is for Dr. Dave Deal from DuPont Family Dentistry.
Yes, this is Edith, and I just went to my dentist here a little over a week ago, and they was doing something different. I went for a cleaning that we hadn't done before, and I don't know if it's because of the COVID or what, but anyway, she had me, a hygienist, had me gargle with a solution for 1 minute. She timed me to, I don't know if it was maybe to get rid of more bacteria in my mouth or what it was for, but it bubbled up, and I'd already brushed my teeth before I came in, but she had me do this anyway, and I think it's going to be a regular thing. I'd just like to know what it was for.
Oh, that's great. Well, I applaud your dentist for doing it. It sounds like some type of peroxide, if it's a bubbly thing. So peroxides they're antimicrobial, but they're antiviral. So a lot of us are doing these kind of things. You can get we call it a pre-procedural rinse. You go in there, and God forbid you have any type of viruses that we don't want to get in there, it will diminish the chance of it. So a good rinse like that will make it a safer experience for us to clean your teeth. So, and also actually kills off the bacteria so it doesn't go in your bloodstream while you're cleaning your teeth too.
All right, Edith, thanks for your call.
Yeah, great question.
So what about that? Should I be using a mouthwash all the time? I've read that some of them are very high in alcohol, and they change the overall makeup of your bacteria and actually make the bad bacteria take over.
Yeah, you're spot on. Again, careful. Over-the-counter mouth rinses, I honestly pretty much avoid them. With the toothpaste, I can kind of switch back and forth. There's things about over-the-counter toothpaste I like. There's things I don't. But mouth rinses, I would highly recommend a Carie-free or OxyFresh mouth rinse, period. That's the best. If you're going to use them, get one of those. They are better in every single way.
And OxyFresh, as you said, is one that I can just on the market.
Yeah, Google it and see if you can find it. Yeah.
Okay, that's great. We'll do. So when I'm brushing, and you said you're a fan of what's the electric toothbrush?
Sonicare. Don't forget Sonicare.
Okay, I have to switch. All right, yeah, I've got to change. 2 minutes. That's the rule, right?
Sure, absolutely.
Now, what happened? I remember when I was in grade school, they gave you this little red pill that you took that was going to
disclosure.
What's this all about, and are they still doing that?
In cases we have kids come in and they're not brushing very well, we'll disclose before we start to show them how bad it is. So those disclosing tablets will actually just stain the plaque that's on your teeth, and it just shows people, hey, these are areas you're missing. You know, if they need extra help in seeing that, that's what we use it for.
And I've read that acidic beverages are particularly bad for your teeth. So what's an acidic beverage, and what I have to look out for?
You know, it's interesting to me in that conversation when you talk about diet and, you know, diet causing cavities. For me, I think it's the drinks that I see more so than anything else. Of course, if you're eating gummy bears all day long, that's not going to be good. But the drinks that we drink anymore, we're so addicted to, you know, energy drinks and Starbucks and, you know, whatever it is, pops and stuff like that. So those drinks, every time, what you'll find, especially people that are into them, they'll stop at the gas station in the morning, stop at Starbucks, and they're sipping on that all day long. So the sugars inside those drinks are feeding, and then they're acidic as well, just by the nature of the drink. And that constant influx of sugar is constantly feeding the bacteria in your mouth and constantly creating an acidic environment. So as those acid levels, you know, rise, you are demineralizing the surfaces of your teeth. You're pulling the minerals out, making the tooth surface weak. Bacteria attach. Bacteria make more acids, byproducts, and the bacteria is what's causing the cavity. But when you're creating an acidic environment, you're feeding sugar to it all day long, you're increases the chances of those cavities happening.
So how? Yeah, it makes a lot of sense. So how do I know whether or not, you said earlier that you have to kind of just bounce around and find a toothpaste that works for you? How do I know that I found the right one? Is it that film in the morning? If I have less,
maybe a little bit of that.
What's the key here?
It's, you know, what amazes me is that some people are very aware of what's going on in their mouth, every little detail, and then some people are completely unaware. So for those people, come and see us. We'll tell you if it's working or not. For other people, you'll have a sense, okay, I'm building more tartar. You have that odd whatever flavor taste in the morning. Just be aware, listen to your teeth, and listen to what your body's trying to tell you. I think that's key. I hope that answers. But, you know, typically the tartar buildup is a good idea. All right, yes, I'm building tartar. Okay, it's not properly cleaning my teeth. Create an environment that doesn't happen. If you're not getting tartar buildup, you should be good.
Well, how would I know? Am I going to see it? Am I going to feel it? I mean,
yeah, that's, again, it goes back to the people. Some people are very much aware. I have a little bit of tartar right now, and it's driving me nuts. I'm behind my schedule on my cleaning. So other people, they're completely unaware of those things in there. So just know yourself. If you're self-aware of what's going on in your mouth, great. Go to, you know, or you're not, go to your dentist and have them help you out.
And when I am brushing, 2 minutes is the key, right? 2 minutes every time.
Is fine. You can go a little bit longer if you want, but you don't need to go 3, 4, 5 minutes. Some people do, but that's too much.
Okay, so I'm wearing away. I'm eroding my gums at that point.
Yeah.
Oh wow, time is gone. We've got to leave it there. Yeah, can you imagine that? I want to talk about sometime in the future. Hope you'll come back. I want to talk about lasers and how you use lasers and what's the latest, greatest, newest thing happening in dentistry. So we'll do that next time around with Dr. Dave Deal from DuPont Family Dentistry the next time he visits us here on WOWO and Health Call Live.